Hi and welcome to Pharma Portal. In this video, we're talking about depression and the medicines used to treat it. We'll first explain what depression really feels like and then get into what antidepressants are and the types available. You'll also learn what happens after starting these medicines, how they work, common side effects, and what to expect in the first few weeks. We'll cover questions like, do antidepressants actually help? Can depression be treated without them? Why don't they work for everyone? And what are the lesser-known side effects? Plus, we'll talk about the top 5 antidepressants, whether they're addictive, and how they're also used for anxiety and other conditions. And at the end, we'll share simple tips on how to talk to your doctor and whether it's safe to stop these meds. Let's get started. So what exactly is depression? And how does it really feel? It's not just feeling sad for a day or two. It's when you wake up tired, even after a full night's sleep. You don't enjoy the things you used to love. It's like losing interest in life slowly. Sometimes you may feel like a burden to others, even if no one said anything. You might think, why am I even here? Or start crying without any clear reason. It can feel like your heart is empty, like a balloon that's lost all its air. In some serious cases, people even get thoughts of hurting themselves. But here's the thing. Depression is treatable, and antidepressants can help people slowly come out of that dark place. It may take time, but there is hope and help available. So what exactly are antidepressant drugs? These are special medicines made for people who feel very sad or worried for a long time, like weeks or even months. They help balance certain chemicals in the brain that control how we feel. These chemicals affect our sleep, energy levels, emotions, and the way we think. It's important to understand, depression is not laziness or weakness. It's a real condition. And just like how we treat diabetes or high BP with medicine, depression also needs proper treatment. Antidepressants can actually help people get their life back on track. Now, you may not be able to see depression like a broken leg, but it's just as real. And these medicines are not meant to make someone super happy or excited. They're simply meant to help them feel normal again. And of course, they should always be taken with a doctor's advice, never on your own. Let's talk about the main types of antidepressants. First, we have SSRIs, selective serotonin reuptake inhibitors. They boost serotonin, the feel-good chemical in the brain. Then there are SNRIs, serotonin and norepinephrine reuptake inhibitors. These work on 2 brain chemicals instead of 1. TCAs, or tricyclic antidepressants, are older types, and they usually have more side effects. MAOIs, or monoamine oxidase inhibitors, are rarely used now because they can react with certain foods. There are also atypical antidepressants like Wellbutrin, which work in different ways. Medicines like Prozac and Zoloft, these are SSRIs and are very commonly used. Remember, each type works differently for different people, so finding the right one might take some time with your doctor's help. So how does this journey begin? Usually you visit a doctor because you've been feeling low, anxious, or just stuck for a long time. After talking, the doctor may suggest starting antidepressants. Now, it's normal to feel unsure. You might wonder, will this really help? Will I feel strange? This phase often comes with a mix of hope and fear. But you're not alone. Millions of people start this same journey every year. Let's now walk through what usually happens from day 1 to week 6.
All right, day 1. You've just taken your first antidepressant pill. Most people don't feel anything different on the first day, and that's totally normal. You might feel a bit nervous, maybe even start watching how you feel very closely. Some people get a mild headache, upset stomach, or feel a bit shaky, but not everyone. It's really important to keep taking the medicine exactly as your doctor said. Don't expect overnight results. It's a slow, steady process. Drink enough water, get rest, and avoid alcohol in the beginning. Also, tell someone close to you that you've started meds. It helps to have support. Now it's week 1, and your brain has slowly started adjusting. Chemical changes are beginning, but very quietly. You might feel a bit strange, maybe more tired, restless, or emotional. For some, sleep improves. For others, it may get disturbed for a while. A few side effects like dry mouth or dizziness can also show up. And yes, it's normal to think, is this even working? During this time, having some support from family, friends, or therapy can really help. Now we're in weeks 2 and 3. You may start noticing tiny changes, like your mood lifting a little, almost like a dark cloud slowly getting lighter. Maybe you're crying less or sleeping a bit better. Some energy might come back, though emotions can still feel flat or numb. A few people might feel more anxious or low for a while. That can also happen. If anything feels worse, do speak to your doctor. But remember, you're moving forward. You're on the path to feeling better, step by step. By now, in weeks 4 to 6, many people start feeling real improvement. Thoughts may feel clearer and everyday tasks don't seem so heavy anymore. You might even laugh more or feel a bit like your old self again. Of course, some days can still be tough, but not all of them. And if there's no improvement, your doctor might adjust or change the medicine. Just remember, healing doesn't always follow a straight path.
Do antidepressants really work? Yes, they do work for many people, but not for everyone and not right away. Medicines like SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin and norepinephrine reuptake inhibitors, help increase the brain's feel-good chemicals. They don't force fake happiness, they just help bring back balance. In fact, around 60 to 70% of people feel better after 6 weeks. One real story said it best. One day, I got out of bed without that heavy dread. Now you might wonder, why don't antidepressants work for everyone? Some people have what's called treatment-resistant depression. This can happen due to genetics, body chemistry, or other medical reasons. Sometimes it takes trying more than one medicine to find what works. For others, therapy, lifestyle changes, or even newer brain treatments might be needed. But the good news is, there are always more options. Healing takes time and patience. So please, don't lose hope. Let's look at 5 of the most common antidepressants used around the world. Sertraline, also called Zoloft, often used for depression, anxiety, and even OCD. Fluoxetine, known as Prozac, it's gentle and very popular worldwide. Venlafaxine, or Effexor, is a bit stronger, works on 2 brain chemicals. Escitalopram, that's Lexapro. It's known for having fewer side effects. And bupropion, or Wellbutrin, it helps with depression and also supports people trying to quit smoking. There's no one-size-fits-all best medicine. What works for you is what matters most. People often ask, what's better, natural ways or prescription medicines? Exercise can boost those feel-good brain chemicals naturally. Therapy also helps a lot. It teaches you how to handle tough thoughts and emotions. Some vitamins, like omega-3, may help if your depression is mild. Lifestyle changes, like better sleep and routine, can help with light sadness. But for deep depression, medication is often needed. Honestly, for many people, a mix of both, natural and medical, is what works best. Antidepressants can have some side effects that people don't always talk about. You might notice weight gain or a lower sex drive. Some feel a bit emotionally flat, like they're better but not fully themselves. Others report weird dreams or even night sweats. These effects aren't dangerous, but they do matter. The good thing is, your doctor can always adjust the dose or switch the medicine to suit you better. People often worry, can you get addicted to antidepressants? The answer is no. There are no cravings like with alcohol or street drugs. They don't give a high, they just help your brain find balance. But if you stop suddenly, you might get withdrawal symptoms like dizziness, mood swings, or those odd brain zaps. This isn't addiction, it's just your brain adjusting. That's why it's always safer to taper slowly with your doctor's guidance. A common question is, should you stop taking antidepressants once you start feeling better? In most cases, doctors recommend continuing the medicine for at least 6 to 12 months, even after your mood improves. If you stop too soon, there's a risk the depression can come back. That's called a relapse. That's why doctors suggest reducing the dose slowly over time, instead of stopping suddenly. Some people need to stay on antidepressants long-term, and that's completely safe for many. There's no shame at all in needing ongoing help. The most important thing is, don't make this decision alone. Always consult your doctor before stopping or changing your medication. Talking to a doctor about antidepressants can feel a bit scary, but it's a very important step. You can start by simply saying, I've been feeling low lately, do you think medication might help? Don't be afraid to ask things like, what kind of side effects should I expect? It's okay to share your doubts or fears. Being honest helps the doctor understand you better. Keep a small record of your symptoms like your sleep, mood, energy levels. This can really help during the visit. Also, ask about therapy options, not just medicines. The combination often works best. And if you feel nervous, take a close friend or family member along for support. You don't have to do this alone. If you've started or are thinking about starting antidepressants, just know this: it's a brave step. The journey may be slow and not every day will feel easy, but it's absolutely worth it. Some days will feel heavy, but remember, heavy doesn't mean hopeless. Help is real. Healing is real. Don't be afraid to ask questions, speak honestly, and stay curious about your own mental health. And most importantly, you are not broken. You are healing. This journey is yours, and you are not alone.
And that's the end of today's video. Hope you liked it. If you found this video helpful, please give it a like and subscribe to Pharma Portal for more simple and honest health content. If you have any questions or thoughts, just drop them in the comments. We're here to help. And if you know someone who might need this video, do share it with them. Thank you so much for watching. Take care and see you in the next video.